Caries has a lot of different phases. It can go anywhere from the early caries lesion to complete destroyed tooth. The dental caries are a bacteria-induced necrosis of tooth structure, and the treatment should focus on the removal of necrotic tissue with a bactericidal approach. Well, if you look at what is being done today in most countries and on most patients, it is that we take away too much. Since in invention and application of rotary instruments, the operative treatment of caries lesions has often resulted in considerable removal of tooth structure. So minimal invasive dentistry focuses on preserving healthy and sound tissue, and the art of intervention lies in not removing more than necessary. The mode of action of chloramines are very exciting. It is actually equilibriums, redox reactions, and radical chemistry all at once. It's a very fast action, and it goes over very quickly and leaves no residuals. The Kindersolv procedure is very easy, but you need to, like always, to train. So when you describe it for the dentist, ask him or her to use it on a very easy access case. You can also use your instrument of own choice. If you want to open the cavity a little bit, you can use the drill. Then just add Kindersolv for clean, safe, and appropriate caries removal. After creating access to the caries lesion, select your instrument of choice. It could be a hand instrument, specially designed, or a hand excavator, or specially non-invasive burrs for excavation. Apply a drop of Kindersolv to the lesion and cover it completely. Wait for 30 seconds. Then start to gently abrade with quick movements. And as you can see here, already after 30 seconds, you can see debris visible. You also have to observe here that we added some color into the gel for this kind of photographs we are taking. Kindersolv hand instrument, if you want to work totally non-invasive. Most drills and excavators are intended to be invasive, while our Kindersolv instruments are not. So back to the procedure. Gently abrade the surface using quick movements. If necessary, repeat, but do not wait 30 seconds. When the gel stays clear and the cavity feels hard, you can check the cavity without removing gel. Remove gel with a dry palette. Check with an explorer. If minor caries areas are left, remove it without applying new gel. Then remove remaining gel with wet pellets. The finished cavity has a frosty appearance. At the end, check again with the probe and then fill according to normal procedures. To summarize the studies on Kindersolv is to say that it removes necrotic, decayed dentine and leaves healthy tooth structure unaffected, which is a minimal invasive approach when biology is an important issue. Kindersolv have no effect on sound and healthy dentine. It leaves a rougher dentine surface suitable for modern restoration techniques. We have seen no negative effects on pulpal tissue. Clinical histological study on oral mucosa after prolonged exposure to Kindersolv did not show any inflammatory reactions. It leaves, when you use Kindersolv, open dentine tubules. You will see a burr group which has surface covered by smear layer. Very few tubules open. And in the Kindersolv group, there is open tubules with minimal or no smear layer. And after application of budding agent, you will see in a burr group, resin tags are shorter and the hybrid layer not as thick as in the Kindersolv group. To summarize our indications for using Kindersolv: caries in the dentine, open lesions such as root caries, deep caries close to the pulp, cleaning of fissure before sealants, antibacterial cleaning including smear layer removal. Our clinical advantages are as follows: minimal invasive and tissue preservation, selective for removal of caries and dentine only, no side effects on healthy tissue, safe and effective, antibacterial, improved bonding, secondary dentine formation when treating caries close to the pulp, and of course less pain and bleeding and less postoperative problems. Special groups to consider are of course introduction to dental care, patients who are afraid, special care groups, immunocompromised groups, and using it in outreach programs.